Hit Exchange Media Coverage, HIMSS 11.
And we found, in terms of EMR implementation, that it's most important to have a partnership of IT and the clinicians. Basically, some of our notable problems came about by attempting to install EMRs that were led either just by IT or just by the clinicians, and in both cases we had problems. But now we've really had a great success with this partnership and dual leadership structure in the implementation phase. But I think that more than just implementing EMRs, it's really important to be able to integrate and coordinate care across the spectrum of care and different kinds of settings, as well as the different medical specialties coordinated with primary care in both the inpatient and ambulatory settings. And so for that, we've really been focused on health information exchange so that our patients can have a full virtual electronic record in place for their caregivers, regardless of where they're seeking care.
Sure. Can you elaborate on that, your role in the HIEs and in the process of integration?
Well, I think we're not quite putting all of our eggs in one basket, but we're focusing on one primary area, which is the Nationwide Health Information Network. We found this to be a very successful implementation. So we first went live for patient treatment with the Nationwide Health Information Network back in September 2009 with Kaiser and the VA, the Veterans Health Administration within the Department of Veterans Affairs. And we started out in San Diego with actually a small patient population of well understood patients. We have a little under 500,000 patients across the country who are veterans, who have part of their care provided by the VA, and now they're in the private sector. They've been discharged from active service, and so they're Kaiser members, and so they come to us for their primary care, but we wanted to be able to coordinate the information for their care with the VA. So we found that using the federal standards for Nationwide Health Information Network, we were able to standardize the data exchange and get up and running for this process with the VA. And of course, there are some hurdles. Anytime you get the government lawyers involved, things don't necessarily go as fast as they do in the private sector, but we were able to get through that really without any significant problems. And the technology we found, we've had some real learnings from that. One of the things is that in the first place, the technology is easier to implement than we thought, and easier to implement than we had heard about. So we're using the HL7 clinical document architecture, the CCD, the continuity of care document, the federal specification, which is the same spec that's used for meaningful use, the so-called C32 document specification. And so we started out using that with the VA, as I said, for patient care, starting out with, in addition to patient demographics, we had problems, medications, and allergies. We've since added, since the go live, we later added immunizations, vital signs, and clinical lab results. So we have a fairly full exchange, and we found also that as I mentioned, the technology specs, which came originally from HITSP, which was the previous ONC effort, just work flawlessly, and were frankly relatively easy to implement from a technical standpoint.
Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.